It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show featuring some of the best doctors in the Houston area that are changing lives. Up first, we're going to introduce you to plastic surgeon Dr. David Altamira.
I had kind of a bump up here on the bridge and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, oh, our kids would have really big noses.
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple. And I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process. And he said, you know, you can always do more, but let's do something modest for now. And it's just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that, you know, we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations, and we can kind of give them a good idea of what they'll actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually, a lot of times, just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape the person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
For dry skin, incorporate more avocados into your diet. They're rich in monounsaturated fat and vitamin E, both of which promote healthy skin. Try them on salads and sandwiches, and even in smoothies.
I came to Dr. Lewis because I always wanted to have really white teeth, and my teeth were straight. I never had to wear braces, didn't have any of those issues, but I had extreme sensitivity. So I could not use any of the whitening strips or just the gels that anyone could. My gums were receding, probably because I am one of those brushers that brush the wrong way. Didn't do the circular motion.
She really wanted veneers. She had just gone through a lot of personal stuff, and she wanted to make a change in her life, but she really did not want her teeth touched. She did not want anything reduced on her teeth or anything prepared.
So he sort of walked me through the process, and I found out that what he could do was I didn't have to have any, didn't have to have my teeth all filed down. They just sort of buffed them, and he just recreated sort of my smile. It's really strange because it didn't change a whole lot, but it did change a whole lot.
So we did the set on her, and they turned out beautiful. I've done thousands of them, and people are very happy with them. And what we found out is, in most cases, they're stronger, even though they're very thin, they're stronger than regular veneers because the strength isn't derived totally from the thickness of porcelain. I mean, you have to have a certain thickness. But it's derived from the bond to the tooth, and we found that when we bond to the enamel, which is the natural outer layer of the tooth, that we get a much stronger, much harder veneer.
Just the craftsmanship was amazing. I mean, it was like going to a Da Vinci or somebody, because it was such tiny details, but it really changed my smile.
So in actuality, not only are they less destructive to the tooth, or you don't have to take anything off the tooth, but they're also stronger, and so they look great.
It was painless. Came back, put them on, was having my hands massaged during the whole process, and I walked out and I had a perfect smile that looked natural. I enjoy smiling, and I love having people say, "Oh, you have the prettiest smile."
If you eat healthy, you're going to be healthy. So what are the major rules for eating healthy? First of all, eat breakfast. It takes your body off that emergency that you've been on overnight. Emergency isn't good for your body. It causes lots of problems with blood pressure and cholesterol. Secondly, eat anything that is red, orange, or green. Those types of foods that are red, orange, or green tend to have what's called phytochemicals. They tend to be antioxidants, and they prevent heart attacks, strokes, and many cancers. Eating a Mediterranean diet is a great idea. The Greek people have a wonderful idea about what to eat. They eat a lot of beans, a lot of fiber, not much in the way of red meat that's high in fat. Fish is an important part of your diet. We need to eat less red meat in America and more fish, and also more non-red meat, like the white meats, like veal, chicken, turkey. Red meat has more cholesterol. Also, barbecued food is not a good idea. The barbecued flavor occurs because the smoke deposits chemicals onto the surface of the meat that taste good, but they also tend to be cancer-causing chemicals. So limit your barbecue to once a
week. For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
All of the great doctors that you've seen on our show today have profiles on our website, complete with bios, photos, videos, and you even have the ability to request an appointment. That includes our next doctor, interventional cardiologist, Dr. Annie Varughese.
As you get older, sometimes you have trouble finding words. So my daughter got all worried, so she'd maybe go to a neurologist. So he does his thing, go back later, he said, "It looks like you had a couple small strokes. They're small, they're not gonna bother you. But," he says, "you need to go to a cardiologist to check out your heart, just to be on the safe side."
Valvular heart disease encompasses many different entities. The heart has 4 different valves, and Gary Singerman had actually infection and rupture of his mitral valve, which is a very important valve separating the top and bottom chamber of the left side of the heart.
So she sent me to Houston Northwest Hospital, where she had them ordered ultrasound for me. I feel fine. Can I go home now? So my wife and I are sitting there, and she comes in with this film of the ultrasound. She says, "Could you see the mitral valve there?" I said, "No, I'm not trained for that." So she points with it to her pen and says, "Right there, it's hanging down in the ventricle. It's been ruined with the bacteria, and it's not doing anything." And so she says, "Within a month, you're going to have a massive heart failure." And I heard my wife gasp, and I got rocked. Wait a minute, I feel fine. She said, "I'm checking you into the hospital right now."
Mr. Singerman had mitral valve prolapse, therefore the valve was not closing properly. was redundant and thick, and therefore it was easy for bacteria to stick to that valve and cause infection. And this happened before I met him, and his story is quite interesting, how he came to me. He immediately needed surgery because his valve was infected and ruptured and not working at all. But he's very thankful that he came because we were able to save him.
Obviously, I lived, but the point is I may not have if Dr. Varughese hadn't caught that ruined mitral valve, and so I owe her.
Welcome. Today we're joined by Dr. Denton Cooley, a native Houstonian and the actual founder of the Texas Heart Institute. What a pleasure to be with you today, Dr. Cooley. Thank you for joining us.
Well, you're welcome, and thank you for visiting our institution.
Can you tell us a little background about how the Texas Heart Institute became an entity?
Well, it, I think, began in the mid-1950s when open heart surgery was first introduced in our Texas Medical Center. And before long, my program here at St. Luke's and Children's Hospital was probably the most prolific of all institutions in the country, including the Mayo Clinic, and Cleveland Clinic, and everything. And we had a simplified technique of open heart surgery and soon began a leadership position in this new field of cardiac surgery. Well, then I decided to create this institute in 1962. So it's been a little over 50 years ago.
What is your most vivid memory about the Texas Heart Institute, about any type of incredible learning that has been occurring here? What's your greatest memory?
Well, of course, our Heart Institute was created with two objectives, that is, research and education. So in each of those aspects of our history, I think there are certain exciting things that have happened.
And when the Texas Heart Institute first came into being, cardiothoracic surgery was high on the list of available procedures to be done for patients. Now we have the artificial heart and the LVADs. And so would you tell the audience about that?
Well, I think that it shows the evolution of cardiac surgery. First, we started off replacing just some of the components of the human heart, that is the valves and the great vessels, and modifying the ventricles and that sort of thing. And then the big breakthrough came in 1968 when we did the first successful heart transplant to replace the entire organ. And that was really an exciting period that followed that. It was such a new concept.
Amazing, right?
Yeah.
And we have actual volunteers here at the hospital who have been survivors from cardiac transplant for about 20 years now.
Oh, yes. Our initial work in transplantation, we did, I think, about 15 or 20 heart transplants in that early era. But so many of these patients suffered from rejection of the tissues. But in the early 1980s, a new breakthrough came with the development of a drug called cyclosporin, which is still in use today and has made it possible for some patients to survive transplantation for 20 or 30 years. So it's a really big change.
Quite miraculous, and you are such a part of that endeavor, and we humbly thank you for everything you've done for the world population, actually.
Well, it's been a great satisfaction to me to see how this institution and our whole medical center has grown during my lifetime.
Thank you, and now we're taking you again all over the world with Best Docs Network, and we just wonder if you have something in these closing remarks, if you can tell our public something about the Texas Heart Institute that you would like them to take to heart.
Well, I think that we have done a great deal to reach our objective, original objective of research and education. but at the same time, we've made many advances in just clinical medicine and surgery, and have enjoyed a leadership position in this new development now. It has sort of inspired the entire medical community around the world. And you can find large cardiac programs going in Europe and South America and elsewhere in North America. Just amazing to see how rapidly it's expanded.
Well, for all of us who have trained under your great leadership, we humbly thank you, and we give you great honor, Dr. Cooley. Thank you for being with us today.
Oh, thank you.
What the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help, and so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
For more information and to check out hundreds of great videos, head to our website, bestdocsnetwork.com. Up next, we're going to introduce you to gynecologist Dr. Meredith Morgan.
Osteoporosis is a disease. It's a disease of bones. It manifests as either a fracture or the realization that the bones are very, very thin with a high risk of fracture. It's important. It's common. It happens in over 50% of women postmenopausal. That's to say, over half of women over the age of 50 are going to have a fracture in their lifetime. And it's serious because some people that have hip fractures will die very quickly. And some people will go into a nursing home and not get out. Since it's a function of time and duration of estrogen deficiency, the time since estrogen deficiency with the thinning of the bone is predictable. It may be needed sooner if there are other risk factors for thinning of the bone sooner. Smoking, extreme thinness, sedentary lifestyle, parents' history, or a previous low trauma fracture. The most objective way to quantitate the status of the bone health, thickness or thinness, is to measure the areas of interest of the spine and the hip, since those carry the most risk of morbidity and mortality. It's done on an X-ray type device called a bone density unit. It's painless, it's easy, it's safe, involves lying on a table and being positioned as you're able. It's not exactly the same as doing x-rays for fractures, although it may be more sensitive for certain kinds of painless fractures. It's not for diagnosis of various diseases or fractures in general. The ultimate goal of screening is to prevent death and disability from fractures. We're trying to predict fractures based on age and the thickness of the bone. If someone has very thin bone, then they have a very high risk for fracture. We recommend that all women have bone density testing at age 65 and sooner if they have risk factors that would indicate that they would have high or increased risk for fracture.
Eating potassium-packed picks such as bananas, cantaloupe, and oranges may help you to be less prone to high blood pressure. In addition, reducing sodium intake and taking other heart-healthy steps will also help to manage your blood pressure.
Gosh, I was young, maybe about 6 years old, and was tagging along with my older brother playing golf, and I just so happened to get too close to him when he was teeing off and got hit with a backswing right in the nose. And from then on, that's when the problem started.
Joey came and see me because he can't breathe through his nose. So he has to breathe through his mouth. He doesn't sleep well at night. He snores a lot, and that makes him tired all the time.
You know, you would sleep through the night but wake up and not feel rested. You know, even though you made it through a whole night and got a whole night of sleep, you just wake up and feel like, gosh, I really don't even feel like I slept at all.
When we examined Joey, we noticed that the wall in the middle of his nose, what we call the septum, that separate the left and the right side, was crooked, in his case, was crooked on the right side, you know, causing him problem to breathe through his nose. And we agreed upon a treatment plan that consists of first a surgery to correct his septum, to straighten up his septum, so to improve the nasal airway.
Very simple outpatient. You know, everything was explained to you. Go in the morning. I actually took a little nap right before surgery because it was early in the morning. Woke up and that was it. So it was real simple, real easy.
Joey's quality of life has improved tremendously. He breathes better, he sleeps better, and he enjoys life more.
Well, you know, you just don't realize it because I've had it for so many years. You just get used to, you're thinking the way you're breathing is normal, and it's not. And then once it's changed the way it is, you know, I'm able to do things without getting winded, you know, because I'm not having to open my mouth to breathe now. I'm able to breathe clear through my nose.
The number one reason that patients come and see me is because they can't breathe through their nose. In most of the case, there's a solution for that. As a Center of Excellence in Nose and Sinus Disease, I'm always in the forefront of medical research to improve my patient outcome. Medicine has advanced so much that there's always a solution to breathe well and live well. Patients don't have to suffer anymore.
For more information and to check out hundreds of videos, head to our website, bestdocsnetwork.com. And up next, we have oral surgeon Dr. Paul Metz.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, you know, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting and then subsequently lower his overall cost significantly as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Adding raw or lightly cooked garlic and onions to your meals may keep you healthy. Both foods appear to possess antiviral and antibacterial properties and are believed to boost your immune system.
Mr. Weber, he basically came in with typical symptoms of plantar fasciitis. It hurts in the morning, or I can't play golf because I'm just always in pain. And
plantar fasciitis, as anyone who's ever had it, it's pretty painful, very, very painful, especially getting up in the morning. And
plantar fasciitis is a pain that honestly, in my practice, I probably see 10 to 15 times a day. So typically, someone complains about that first step in the morning when they get down. When you bear weight, okay, your arch actually collapses and your foot gets longer, and this ligament-like structure that's on the bottom of the heel pulls from the heel bone. So when it pulls from the heel bone, you get inflammation. Inflammation triggers the pain cycle. So essentially, every time that you're bearing weight, you're restarting the pain cycle, and it's chronically inflamed tissue on the bottom of the heel.
Well, I have to say that this procedure is really amazing. After the recovery time from the surgery, it really is immediate relief. Immediate.
The Tenex procedure is basically, it's an ultrasonic device that allows you to debride the scar tissue. So when you have plantar fasciitis or any kind of inflammation of a tendon, you develop scar tissue. And so using ultrasound for guidance and using a micro tip, you're able to debride the scar tissue, remove it, and basically start the healing process. The key feature about it is that it's a single incision, one suture, and the patient can weight bear immediately after. So it's cutting edge technology combined with minimal incision surgery.
It's really remarkable. I mean, it's truly remarkable. I don't have any pain in the area that it affected me. It was really, truly amazing.
It's a 15-minute procedure. It's very precise because you're using an ultrasound machine for guidance, so you can actually visualize the plantar fascia. And it's minimal incision, literally just one suture on the inside of the heel. So it's not on a weight-bearing part, so you can immediately weight bear after the surgery. Patients love it, and so I love having this as a new thing I can introduce to my practice.
That's going to wrap up today's episode of Best Docs Network, the show featuring some of the best doctors in the Houston area that are really changing people's lives. For more information and to check out hundreds of videos, head to our website, bestdocsnetwork.com. And if you have questions or comments, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. I'll see you next week.